Hey, my name is Joseph Moore, and I was wanting to talk to you, the patient, today. And I'm just going to start off by saying that back pain is one of the most common reasons people seek chiropractic help. And often, it goes deeper than just a muscle strain. There's a deeper underlying problem there. We're going to dive into 3 different common spinal conditions. The first one's going to be disc herniation. The second one's going to be spinal stenosis. The third will be facet hypertrophy. We'll explore what they are, how they're diagnosed, and the signs of nerve involvement, and how chiropractic and conservative treatment can help, but if needed, they can be co-treated with different specialties. Our first one, disc herniation. A disc herniation occurs when there's a tear in the annulus fibrosus in the middle gel-like layer, which is the nucleus pulposus, comes out and presses against nearby nerves, causing radicular symptoms, such as pain, numbness, or tingling that radiates down the legs or arms. Some of the symptoms would be shooting pain down a limb, numbness or tingling, muscle weakness, or loss of reflexes in a more severe case. Usually, an MRI is done to locate the problem. Now, our second thing, spinal stenosis. Spinal stenosis is the narrowing of space within the spine, most commonly in the central spinal canal, or the foraminal canals, where the nerve roots exist. This narrowing puts pressure on the spinal cord and nerves. Some of the symptoms would be pain or cramping in the legs, numbness or weakness in the legs, and relief when leaning forward or sitting down. In severe cases, there will be loss of bladder control. Now, an MRI or CT is commonly used to visualize the extent of narrowing in the nerve compression. Our third topic is facet hypertrophy. The facet joints in your spine allow motion and provide stability. Over time, wear and tear or arthritis can lead to facet hypertrophy. That means that there's a thickening or enlargement of these joints that causes them to become stiff and hard to move. Unlike disc herniations, facet-related pain usually doesn't radiate far down the limbs unless there's associated nerve compression. Defined facet hypertrophy is usually CT scans or MRI. But diagnosis is often based on a combination of imaging and clinical exam findings. Some of the neurological symptoms, which apply to all 3 of them, would be radiating pain down arms or legs, numbness or tingling, muscle weakness, loss of reflexes, difficulty walking or coordination issues, and like I said, in some of them, a loss of bladder or bowel control in severe cases. In all 3 of these conditions, us as chiropractors will give you conservative treatment. We'll use the exam findings and imaging to be able to tell the exact place that your problem is occurring, which level of the spine. And we will use spinal adjustments and extraction and distraction techniques, therapeutic exercises, and educate you on exercise therapies. Now, we also can co-treat with different specialties, such as in the case of disc herniation, we can co-manage with a neurologist, and they can either prescribe things like injections to help the pain or surgery if needed, such as in those cases of bowel incontinence. I hope that this new knowledge of these 3 different topics that we've had today explains to you what they are and how chiropractors can co-treat with different specialties. Thank you.